our objective is to define the problems of client and the explanation of the injuries.
Hi, Assalamualaikum. I'm Sarah and I'm with Sabrina and Alia. Today, we would like to introduce our client. Hi Mini. Can you introduce yourself?
Hai, nama saya Aminah Azim bin Muhammad Fukarudin. Saya berasal daripada Selangor dan major sport saya adalah bola sepak.
Your highest achievement in your major sport?
My achievement is Piala Emas Raja-Raja Wakil Negeri Sembilan.
Next question. Who influenced you to play football?
Ayah saya yang memberi minat kepada saya untuk bermain bola sepak sejak daripada kecil.
So next question is, when you start your career in football, and can you explain more about your journey?
Mulanya saya bermain bola sepak pada umur darjah 5. Waktu tu ayah saya bawa saya pergi tengok permainan bola sepak. Dan bila saya tengok tu saya rasa minat lah. Lari apa semua, main bola. Dan di situlah bermula saya bermain bola sepak. Dan ayah saya mula masukkan saya dalam kelab di kawasan perumahan.
So, did you get any benefit of involved in sport football?
Benefitnya adalah saya dapat meluangkan masa untuk beriadah daripada melakukan benda-benda yang tidak berguna.
Thank you, Sarah. So, I will continue by asking some question regarding to injury. So, I would like to ask you some question. Can I ask you some question?
Yes.
So, for the first question, what is your current injury and where is located?
Sekarang saya sakit ankle sprain grade 2 dekat bahagian kiri, dekat bahagian dalam dan luar.
How and when the injury happened?
Dia berlaku semasa saya bermain bola pada 2 bulan lepas. Masa saya tengah main, saya challenge bola 50-50. Saya lompat, tapi bila saya mendarat, time dia langgar tu saya salah landing lah kaki saya.
Understand. So next, did you do some initial treatment after you get injured?
Selepas saya injured, saya buat rise. Lepas tu esok ni baru saya pergi ke klinik. Saya cucuk ubat radang dengan PRP untuk cepat pulih. Selepas 2 minggu, baru saya pergi buat fisio.
Can you rate your pain scale 1 to 10 during and now?
Semasa memang 10/10 lah, tapi sekarang 5/10.
Okay. How do you feel after you get injured?
Rasa macam nak give up lah, sakit dia. Ingatkan dah tak boleh main dah.
Thank you, Alia. So I will proceed to the next question. Do you have any concern about how your injury might affect your current training?
Dia memang effect sebab masa main tu memang akan rasa sakit tu. Saya kena strapping lah setiap kali sebelum main tu. Kalau tak strapping memang tak boleh main sukan apa-apa dah.
Okay, next question. When injury happened, did it make any sound?
Dia bunyi pop dekat keliling ankle tu.
Next question. Can you tell me, did you have any experience past injury?
Tadi.
So regarding your explanation, I can conclude you have a micro trauma because you have a sprained ankle. For the last question, based on your doctor letter, the fracture in your letter, do you already did the X-ray and explain more about what the doctor said?
Waktu kena tu ada buat X-ray, tapi X-ray dekat hospital tu macam tak betul sangat. Lepas tu cuba keluar pergi klinik lain untuk buat X-ray baru. So dekat X-ray baru tu baru nampak semua detail, tak ada retak, tak ada apalah. Cuma ada ligament tear sikit. Hampir putus lah macam tu.
For this athlete, he has had hand ankle sprain before. As you can see here, we can notice the difference between the right ankle and the left ankle. One is swelling and another one is not swelling. The most noticeable thing we can detect when he adopts anatomical posture is that his shoulder and pelvis have been set, so the left side is higher than the right side. For more clarity, we can look at this side. What we can explain here is that his right leg became high arched because his left leg could not fully support the body weight due to pain of the ankle sprain. So, in this video, we are going to palpation the foot and ankle. The objective of doing the palpation is to gather the information regarding of the structure within this area. This technique involves using the hand to assess various attributes such as temperature, tenderness, swelling, and anatomical alignment. Based on the referral letter, the athlete has injured on the left foot, so we will palpation the left foot first, and we will repeat the right foot with the same assessment. So, we will start palpating the gastrocnemius and the soleus muscle, the Achilles tendon, and directly to the lateral malleolus. Next is the medial malleolus, the tarsal bone, the calcaneus, the plantar fascial ligament, the base feet metatarsal, and lastly, the metatarsal phalangeal joint. So, we will repeat the same assessment, but we will palpating on the right foot. The information that I have found based on the palpating the athlete is, the athlete feel a little pain in the tarsal bone, where he felt a little tight in that part. He also felt a little pain in the navicular region. What can I conclude based on the palpating the athlete is, he is still in recovery and needs some training for flexibility and strength to reduce the pain or tight for the certain part and can play the sport as soon as possible.
This is the data we collected, and I will show you the difference between injured ankle and normal ankle. For the right ankle, it refers to normal ankle, and for the left ankle, it refers to injured ankle. Dorsiflexion and plantar flexion are crucial movements at ankle joint during walking gait cycle. During heel strike and toe off, the athlete alter the plantar flexion movement and also dorsiflexion during swim phase due to reduce the pain.
Now, this is going to see active range of motion assessment of the ankle meaning. In active range of motion of the ankle complex, we are looking at the following movement, which is dorsiflexion, plantar flexion, inversion, and inversion. Firstly, patient need to lay in supine position with fully extended legs and the feet hanging off of the edge of the table. This is the plantar flexion of Aminin. And this is dorsiflexion. Aminin said he feel hurt when did the dorsiflexion. For the inversion, patient need to bring the soles together. And for the inversion, patient need to bring the soles away from each other. Next, we are going to do passive range of motion assessment of the ankle. In passive range of motion for the ankle foot complex, we are looking at the following movement, which is dorsiflexion and plantar flexion, inversion and eversion. Firstly, hold above the malleolus and grab onto the foot behind the calcaneus and have the foot sole on your forearm, and then bring it in dorsiflexion. For plantar flexion, hold above the malleolus, grab on the foot, and move it into plantar flexion. Next, for inversion, hold the tibia and then let move it the foot inward. For the inversion, move it the foot outward. Next, we're gonna do the weak bearing lunge test. Weak bearing lunge test is the type functional mobility assessment. It measures ankle dorsiflexion, range of motion in a weak bearing position. The method of this test is the patient lunges forward with one leg, keeping the heel of the tested foot flat on the ground, while the other leg moves backward. The distance or angle between the toes and the wall is measured. The result that we get, right leg patient can achieve until 12 cm, start with 4 cm. However, the injury leg, which is left leg, only got 4 cm because the patient getting pain. Next is strength training for ankle injury, which is single leg heel raises. Single leg heel raises are an effective exercise to build strength in the calf and improve ankle stability, especially during rehabilitation or strength training. There are 3 benefits of single leg heel raises. Firstly, strengthen the calf muscle. Number 2, enhance ankle stability and proprioception. Number 3, improve balance and reduce risk of re-injury. Lastly, mimic functional movement like running, jumping, and walking. This exercise is particularly beneficial for recovering from ankle injuries and preventing future issues.